Now we are going to hear from Laura Watne, who is a registered dietitian and board certified specialist in pediatric nutrition. She has enjoyed working at the multidisciplinary neuromuscular clinic at Children's Hospital Colorado since 2011. She has co-authored 2 peer-reviewed journal articles, Clinical Course of Growth in Patients with Congenital Neuromuscular Disease in a Single Multidisciplinary Neuromuscular Clinic, and Nutritional and Gastrointestinal Management of the Patient with Duchenne Muscular Dystrophy. She was a member of the Gastrointestinal and Nutritional Management Working Group for the recent Diagnosis and Management of Duchenne Muscular Dystrophy publication, and she is also a member of the CURE SMA Medical Advisory Council. So Laura, thank you very much for being here today. I will let you go ahead and share your screen.
Okay, great. Thank you for that nice introduction. Let me bring up my screen. Great. So yes, today I'm just going to, much like Dr. Coover said, cover a lot of ground here. Although there's so many different neuromuscular diagnoses, there's a lot of commonalities when it comes to nutrition. So hopefully we can touch base on a lot of the different diagnoses. So just a couple of disclosures. One that was already mentioned, I am a council member of the CURE SMA Medical Advisory Council. And part of the position I hold at Children's Hospital Colorado in the Neuromuscular Clinic is partially funded by the MDA. So today I have 2 objectives. First, to review the essential nutrients and the role they play in a variety of nutritional challenges that kids with neuromuscular disease face. And then we're going to review how kids with neuromuscular disease can maximize their dietary intake of all of the essential nutrients. So here's just a graphic. Much like Dr. Cooper said, he thinks pulmonary functions is the most important. Well, of course, I think nutrition is the most important because it really does impact all of our body systems and everything about how our body works. So really today I'm just going to spend a brief amount of time going through each of these systems and how nutrition plays a role in that. So we're going to look at growth and development, how it affects our heart, lungs, bones, how nutrition impacts your kids' weight, their skin health, how their intestines are functioning, their muscle and nerve function, and then it's very important for our brain health as well. So within each of those systems, we're going to talk about how the 6 essential nutrients are important. So there are 6 essential nutrients: carbohydrate, protein, fat, vitamins, minerals, and water. And all of us need to get these nutrients from our diet because our bodies can't make these nutrients without coming from our dietary intake. So these first 3 of the 6 are carbohydrate, protein, and fat, and these are the nutrients that provide energy for our bodies, and they give us energy for our body systems to work and move. And so we'll be talking about how that plays a role. Vitamins and minerals, while they don't provide energy or calories, they are essential and necessary in how our bodies extract energy from carbohydrate, protein, and fat, and they're involved in the structure of our bodies, and every function that your body does requires vitamins and minerals. And then of course, water is super important. Every process in our body requires water, and it's very important for kids with neuromuscular disease to get adequate water. So let's just go through each of those topics I had in that first graphic. The first is growth and development, and this is so important. No matter what diagnosis your child has, they're a kid and they need to grow and they need to get bigger, and their bodies need to develop and their brains need to develop. And so this is such an important part of what I look at. So good nutrition promotes growth and development in babies, kids, and adolescents with neuromuscular disease. And it really is sort of the main indicator for nutrition status. And I can really glance at a growth chart and kind of have a pretty good picture of a child's nutrition status just by looking at how they're gaining weight and how they're getting taller and how their weight relates to their height. So of course, the important nutrients involved with growing and developing are those energy providers. So carbohydrate, protein, and fat provide energy, and they are also the building blocks for tissue growth. And so your child can't gain weight and can't get taller if they don't have these basic things providing energy and the building blocks for growth. And of course, all the vitamins and minerals are essential for growth and development, but I just wanted to highlight a couple of them here. Iron, mostly because it is the most common mineral deficiency worldwide. And we can monitor iron status with blood tests. And the reason why it's so important is it helps deliver oxygen to the growing cells. It's involved in hundreds of chemical reactions in the body. And similarly, zinc helps deliver oxygen to growing cells, also involved in hundreds of chemical reactions, and commonly kids can be deficient in zinc as well. Unfortunately, we have a blood test for zinc deficiency, but it's not super reliable, but it is something we can check with a blood test along with iron if indicated. And then along with just talking about growth and development, unfortunately, there are no growth charts specific to neuromuscular disease. There's some limited data for boys with Duchenne muscular dystrophy. There's some charts that were developed. They really only go up through age 12 for boys that are walking. But other than that, no specific charts. That doesn't mean these charts aren't useful. We still use the regular growth charts and monitor your child's growth over time. And it still can be a very useful tool, and I'll talk about that a little more later. So along with growth and development is growth in height, and measuring height in children with neuromuscular disease can be a challenge, as you are probably aware if you have an older kiddo at home. It can be especially difficult as they get older if your child has scoliosis or if they have joint contractures in their hips, knees, and ankles. It can just get tricky to measure exactly how tall they are. So ideal if your child can stand, we like to get a standing height. If they're not able to stand, we can do length boards. Obviously, for all infants, we're using a length board, but your clinic, your multidisciplinary clinic should have an adult length board. So if your child can lay relatively flat, that's a great type of measurement to get for your child's height. If they can't stand or they have too many contractures for a good standing height or a height lying flat, we'll do a segmental length to try to get the most accurate height. So I do have some pictures here. So what we would do is if your kiddo can sit, we would measure their sitting height, like we are doing with this kiddo here. We can use sort of a yardstick type tool like a tape measure. If your child's not able to sit, we can measure that distance from their head to their sitting surface on a length board. So this guy is on a clear length board there, and we can get the same measurement as if he were sitting. And then we can add that to the segment from the hip to the knee, and then the knee to the bottom of the foot. And there's not a lot of good data out there on measuring kiddos with neuromuscular disease, but anecdotally in our clinic, this method has really produced some nice results and looks consistent for the most part on the growth charts. The next category, real briefly, I wanted to mention was heart health, and nutrition is very important for that. If your child has the type of neuromuscular disease that might have some heart involvement, if that heart involvement is happening right away early on, infants with heart disease that have very high energy and protein needs for growth and development. So that might be something you'll see a baby needing lots of extra fortification in their formula or breast milk with extra calories and protein. And of course, again, adequate protein, vitamin, mineral intake is required if your child needs any type of heart surgery or I work with some older kids who've had a heart transplant, and all those vitamins and minerals, of course, are really important for healing from those surgeries. Heart failure can be something that young men with Duchenne may experience. Um, so there's some important nutrients in that situation, especially if they're hospitalized. So oftentimes, if your son has heart failure, they might be on a fluid restriction in the hospital, and the medical team might need to put them on that fluid restriction. So this can make it difficult to get adequate nutrition, but so it's just something we work with the team on. And then increased energy and protein needs, again, for just being hospitalized and supporting the illness. And again, with heart failure, we often see someone might not tolerate eating very well or tolerate their normal tube feeding plan because their heart isn't pumping enough blood flow and oxygen to their intestines. So it becomes difficult to tolerate eating and food in that situation. And then just for general health reasons, family-centered healthy eating to help you as parents and adults and caregivers, and also your kids, prevent adult heart disease. And that's just healthy eating for everyone. And a couple of the important nutrients that we talk about in that scenario is fat and cholesterol. And of course, once again, going back to growth and brain development, kids really need fat for that, especially the first 2 years. But after 2 years old, to start thinking about more well-balanced meals with a variety of foods and trying to limit fat to about a third of the energy intake. And as Dr. Kufer mentioned, lung health and nutrition is very interrelated and interact with each other and are very important. So there's this cycle in, especially we see in the congenital muscular dystrophies and myopathies, where weight gain, respiratory status, and swallow function are very interrelated and have a big impact on each other. And same with SMA, and later on in Duchenne, this all becomes very interrelated. So poor weight gain, weight loss, respiratory infections, and respiratory failure are common reasons for hospitalizations in infants with muscular dystrophy or myopathy. So this cycle of problems can be one of the main reasons why your kiddo may be hospitalized early on. Swallowing difficulties and poor weight gain in and of themselves can be a sign of pulmonary impairment. And then poor respiratory function can result in poor appetite, fatigue, difficulty swallowing, and poor growth. So it really is just a cycle and reciprocal relationship here. And as Dr. Kufer mentioned and showed that picture, so many of these muscles are involved with breathing. And so if your child is working hard to breathe, it may be causing them to have poor weight gain because they're burning so many calories breathing. So poor weight gain is one of many of the indications for respiratory support. And when we think about lung health, the important nutrients, again, is this common theme of getting adequate energy from carbohydrate and protein and fat to provide energy for those breathing muscles to work and for your kid to grow. So it just takes a lot of energy to coordinate all of this: growing, breathing, swallowing. If your kiddo does get a respiratory infection, iron and zinc, again, are very helpful in our bodies fighting infections. And water is super important when it comes to lung health. Kids with neuromuscular disease sometimes, especially if they're on respiratory support, have pretty high fluid needs, especially here in Colorado. We're already at altitude. It can be pretty dry here. I'm seeing kids that need 1.5 times the amount of water as what would be considered normal for their size, especially if they're getting respiratory support. And then along with weight gain and respiratory support is swallowing, and Dr. Cooper alluded to this as well. But poor chewing and swallowing function can result in small amounts of food and fluids going into your child's lungs when they eat or drink, and that's called aspiration. This can also happen just with their respiratory secretions, even when they're not eating and drinking. But thin liquids are more commonly aspirated than solid foods. Some kids, unfortunately, aspirate all consistencies, thin liquids, thick liquids, and solid foods. And aspiration can cause respiratory infections, and in and of itself, aspiration can cause poor weight gain because your lungs are constantly having to fight off this infection, and your body's using energy for that. So signs and symptoms of aspiration: coughing, choking, difficulty swallowing, tiredness with chewing, poor feeding in infants, and poor growth due to long meal times. And so again, depending on what diagnosis your child has, these symptoms may have all shown up very early on, or it might be a more gradual progression that you see happening later. And some kids don't have trouble with this at all. Dr. Cooper mentioned a swallow study. So one of the ways we look at aspiration is called a video fluoroscopic swallow study. And if you're not familiar with that, that takes place in a radiology suite. And it's actually just a moving video x-ray of your child swallowing liquids and maybe solids with barium in it, so that it shows up on the video x-ray. And then there's a dietitian, a speech and an occupational therapist, and the radiologist there, all watching the video and monitoring growth and everything, and can make a plan based on the results. Another way to check, and actually what we found works better for our older young adult men with Duchenne, is what's called a FEES, or a fiber optic endoscopic evaluation of swallow, and that happens at an ENT appointment. And there's usually the ENT doctor and a feeding therapist who evaluate the results of that study. And that's where a small camera is placed through your nose and can visualize swallowing. So if your child is having aspiration, the main treatment, if it's just the liquids that your child is aspirating, is thickened liquids, and there's a variety of different thicknesses. But sometimes if your child's aspirating more than just liquids, they might need an alternate means of nutrition, namely a feeding tube, and we'll talk about that a little more in a little bit. Bone health is another area that nutrition is very important for. Decreased mobility, muscle weakness, long-term steroid therapy can all be risk factors for osteopenia. Kids can have bone pain, fractures, and this can really impact their quality of life. So the important nutrients we think about with bone health are, once again, adequate energy from carbohydrate, protein, and fat, because we want kids' bones to be growing, and growing bones, just that pressure and tension on the bones growing helps keep them as strong as possible. So just that adequate weight gain and growth can really help maximize your child's bone health. Calcium is the most abundant mineral in the body, and 99% of the calcium in our bodies is in our bones. So it's really important that your child is getting enough calcium. And if they're not getting enough calcium, it will prevent them from reaching their peak bone mass, which is when their bones will be the strongest. And then vitamin D is very important. It's essential for bone mineralization and is required for the calcium to be absorbed into the bone. And vitamin D is one that we can monitor with a blood test really easily. So we do recommend that annually, an annual check of vitamin D. And if your child has low vitamin D and needs to supplement, we might check it more frequently than that even. And again, there's not a great nutritional lab for calcium, but we can check vitamin D. The next topic is weight management. So a lot of kids with neuromuscular disease might struggle with being underweight. Sometimes we look, and this comes back to the growth charts as I was mentioning before, but we don't have to expect a kiddo with neuromuscular disease to track on the normal growth curves because their bodies are different and they have lower muscle mass. So we might say it's acceptable for your child if they are underweight to follow a near parallel weight gain on the growth chart. So maybe they're a little bit below the growth chart, but as long as it's following the general shape, sometimes that's okay if your child has been healthy, if they don't have excessive fatigue, if they haven't been getting sick, and they're getting appropriate respiratory support. Sometimes we might just over time say this child's a little bit underweight, but growing and gaining, and that's okay. One way we determine underweight is by looking at body mass index, and that's just a ratio of weight to height. But as you can imagine, that's not a great indicator in a kiddo with a neuromuscular disorder, but we can still, again, track it over time and track it on the regular growth charts and just see the trend. And again, another reason why height is so important is we use height in this equation. So another tool that I use besides the growth charts is what we call arm anthropometrics. So one thing we can measure is an arm circumference and then a tricep skin fold. And these can sort of help us define what your child's body composition is like, and we can do this pretty quickly in clinic. These aren't the most reliable measurements, but it really helps if the same clinician is taking the measurements over time. So once again, you can compare these over time. So here's a picture of an example. You just find the midpoint of the child's arm. So the arm circumference is just that measurement around the arm. And then that far picture on the right is the tricep skin fold. And what that shows, and then I can do some equations and sort of estimate, for example, in your child's arm, what percentage is muscle versus what we call subcutaneous fat stores, which we have standardized numbers for that, much like a growth chart. So that's just another example. Every person, we have a little bit of fat layer under our skin, and that's important, and our bodies need it, and kids need that to help them grow and support their respiratory health. And so I can kind of measure those numbers over time. And it can just be a useful tool, especially if your child is underweight. We can track these numbers as well. So all that to say, sometimes it's okay if kids are underweight. But if your child's weight truly is too low, which sometimes happens, maybe they're a little bit underweight, but maybe recently they've been having trouble gaining weight or their weight just got really too low. We want to make sure the respiratory support is adequate, and we want to try to increase their calorie intake either through the foods they're eating. We can do oral supplements, like Pediatric or Boost, or if they need tube feeds. So it's a delicate balance. Maybe it's okay for kiddos underweight, but we don't want them to be too far underweight, and then we want to address that. Overweight can also be a common issue for kiddos who have low muscle mass, low energy expenditure, if they're wheelchair dependent. Sometimes kiddos with neuromuscular disease have short stature. Sometimes they're on medication like steroids that give them a bigger appetite, and these can all lead to unintended weight gain. I've had some kiddos go from using BiPAP or AVAPs and then do a trach vent, and then suddenly their energy needs are lower because the vent is doing more of their work of breathing, so we might need to adjust calories in that scenario. There's really limited data on energy and nutritional requirements for children with muscular dystrophy, so again, I really use the growth charts to help guide me on what your child needs. But there's, again, a little bit of data for boys with Duchenne. They do tend to have short stature, and they have predictable changes in energy needs. For example, when they transition to using their wheelchair full time, or if they're taking the chronic steroid treatment, those are times when their mobility goes down and the energy expenditure goes down, but maybe they're eating more because their appetites increase because of the medication. So those are just things we can try to predict and help with. So again, we adjust the energy intake to achieve desired weight stability or a slow, gradual weight loss. A lot easier said than done, especially in older teenagers. Um, but we work together with the family and the kid and our team to try to help kids and families eat healthy together. Um, we really don't recommend drastic dieting or drastic weight loss for kids with neuromuscular disease. And in fact, even if your child is a little bit overweight, but they come to clinic having some drastic weight loss, we start worrying a little bit and, making sure lung function's good, heart function's good, because we don't want to see drastic changes in short periods of time. Good nutrition helps with skin health, um, helps keep skin healthy, prevents pressure sores, help heals wounds, promotes healthy hair and nails. Again, adequate energy to have a healthy weight to give padding to your bones if your child is wheelchair dependent. Protein is important if there's an open wound or healing from surgery. And then again, there's specific vitamins and minerals that help keep skin healthy. Intestinal health is very closely related to nutrition. Good nutrition can help your child poop regularly and can help prevent and treat constipation. This is a very common problem. So the important nutrients are this special type of carbohydrate, which is fiber. There's different types of fiber that helps our stool have form. And then of course, water is very important to help keep your child's poops soft. But despite great fiber intake and great water intake, it's also very common for kids with neuromuscular disease to need medication to help treat their constipation. And that's because their abdominal muscles are weak, their GI tracts may have poor motility, and just by fact of the kiddo not having a lot of mobility, those are all contribute to constipation, and you may need medicine on top of good nutrition. Good nutrition contributes to muscle and nerve health for growing kids. You want to nourish your muscles and nerves to optimize your physical therapy, to optimize all of these amazing new treatments that are available. Unfortunately, taking certain nutrients or supplement can't fix the underlying problem your child's having with their muscle or nerve cells. But again, taking in enough energy, protein, nutrients to help them grow and develop what healthy muscle and nerve tissue they do have, and again, maximizing the benefits of these exciting new treatments. Good nutrition is fuel for your child's brain at school and at rest. Again, adequate energy from carbohydrate, protein, and fat for their brains. Iron is involved with sleep, so low iron can be associated with restless sleep, and iron is important for learning, and low iron can be associated with poor school achievement and even some behavior issues. And then just in general, aside from all the nitty-gritty details of nutrients, just that social enjoyment of food and meal times and cultural and holiday traditions and family celebrations is so important. But that can be tricky when your child needs texture modifications or your child is not able to eat by mouth. So how can kids with neuromuscular disease get all the nutrients they need? There's 6 ways to nourish your child's body. One is four ways I have outlined here to get the 6 essential nutrients for your kiddo. The first is a regular diet, and your kiddo may be able to enjoy a regular diet. They may need some texture modifications and do what we call a mechanical soft diet or a pureed diet, or your child might need to have tube feedings. So here's just a picture of a variety of foods from a well-balanced diet that can help your child get all the 6 essential nutrients that their body needs. A mechanical soft diet, you can enjoy all the same foods as a regular diet, but you might need to get creative with texture for easier chewing and swallowing, and they might need thickened liquids. So you would focus more on soft foods that are easy to chew and swallow, Some pro tips I've learned from patients over the years, and this is something that might come out of a swallow study, but if your child has trouble with chewing and swallowing, that's milder, but alternating bites of foods with sips of water or sparkling water can help with chewing and swallowing. Um, Trying to keep your child independent with feeding themselves for as long as possible is great. So using lighter utensils and finger foods, and occupational therapists can help your family with that. A lot of like teenagers with Duchenne, they can continue to feed themselves if their surface is raised high and they can support their elbows, and they can continue to enjoy feeding themselves. And then hydration is so important. Just coming up with creative ideas to attach a hydration system to your wheelchair by using like a camelback or a special straw, so that it's not a big problem for your child to get to the water that they need to be drinking. A puree diet, really, you can liquefy just about any food and thin it in a blender until it's smooth, and your child can enjoy pureed foods. And a pureed meal may not sound very appetizing, but some kids do great with this. So you could really blend your family meals, anything that your family's eating, blend it in a blender with some liquid to make it drinkable. I had one family who was buying frozen meals and throwing them in a blender, which was kind of nice because the calories were consistent. And then, of course, there's a lot of naturally pureed foods that you can offer your child if they need that more pureed consistency. And then for tube feedings, first I want to highlight that the decision to place a feeding tube is very stressful and can be a stressful moment in your child's journey. But I do want, much like Dr. Cooper was talking about a trach being a tool, this is a tool to help you feed your child. But I just want you to know, we recognize this is a hard choice and a hard time. For some families, the kids need it really early on, and it's not really a choice because they may be having so much trouble breathing and swallowing. But for other kiddos, it becomes a choice later on, and it's just a hard time, and your medical team will be there to help support you. But I do have quite a few families who come back to me and say, gosh, we were really fighting that, but we're so glad we got the tube, and we kind of wished we did it sooner. And it was almost relieving to get it. So many wonderful formulas to choose from now that are new, that weren't even available 10 years ago when I first started in clinic. You can, of course, make your own formula. It's a ton of work and big commitment, but there's so many nice commercial blended food formulas. There's standard formulas, and if for some reason your kiddo has special issues, there's a lot of specialty formulas out there. Tube feeds can be bolus, kind of on a meal schedule, or they might need to be continuous with a pump going all the time, or sometimes we use both of those schedules in a 24-hour period. And there's really no right or wrong. It's more about what your kiddo's tolerating and your family routine and schedule at home. Also super important to emphasize, your child may still be able to eat by mouth after getting their feeding tube. Even if they've shown they've had aspiration, you can make a plan with the team to say, we want to do something for quality of life, even though we know there's a little bit of risk there. But to work with the team again, so you can enjoy feeding your child and they can still enjoy having some things by mouth. Some other patient pro tips. I have some families that try to give their kiddos their tube feeding at the same time as their family meal. That might be a little chaotic and hectic in some people's homes, but it's an option or something to work towards, that it still can be part of that mealtime routine. And then I have one patient I can think of specifically that is just so great. Their child needs continuous feeds, but they just put on a backpack and go about their activities, and it doesn't really slow them down at all, needing to be on continuous feeds. So really, oftentimes, a combination of these feeding methods are used to get all the essential nutrients for your child, and it might be a combination and not just one or the other. And then just lastly, to wrap up, um, in your child's diet, if they're, whether they're eating by mouth or getting G-tube feeds, do they need any vitamin or mineral supplements? So this is where a dietitian can be super helpful and assess what your kid is getting, compare what they're getting to the recommended intake for their age. There are certain blood tests we can do that are helpful. The most common ones that I'm involved with are iron and vitamin D blood tests. The most commonly needed supplements are calcium, vitamin D, iron, zinc, and or a multivitamin. But it's very important to understand that vitamins and minerals interact with each other. So we don't recommend mega doses unless you have a documented low lab. For example, especially if iron or vitamin D, that might be something we'd recommend supplementing pretty high for a short time, but we'd be monitoring it with labs. Otherwise, we don't want to have imbalances. So a multivitamin is usually recommended over megadoses of individual vitamins. And then there really is limited data on how other types of supplements help kids with muscular dystrophy. I have a lot of families who are interested in different supplements and try different things, and we can work together to do that safely, but we just unfortunately don't have a lot of data on that. And I think there's some references if anyone wants to look up more information. But thank you. This is a blast of the past picture from 2015 of our muscle clinic group. But thank you for having me today.
Thank you, Laura. I was curious, we get this question often. Is there an amount of calcium that each child is or should be taking?
Yes, so there's a dietary reference intakes, and it's based on gender and age. So
Mhm.
it can range anywhere from like 400 to 700 for an infant up to 1300 for a growing teenager. So it depends on your
Yeah.
child's age, and you don't need to supplement above that amount, but
Okay.
between food, formula, and supplements to meet the RDA is the goal.
Okay. Is working with a dietitian the best way to approach weight loss with your child?
Is that meaning if they're overweight to
Yes.
to approach weight loss?
I'm assuming so.
Um,
If I'm incorrect, please let me know.
yeah,
Yes, yes, she said.
okay. Um, well, they're a great resource.
Uh-huh.
I think it's um, as a part of a multidisciplinary clinic, we don't have a lot of time. So for example, at our institution, we have a separate program for weight loss that's available. And again, understanding that you as a family with a kiddo with muscular dystrophy have a lot of appointments you're going to, it can be an additional burden sometimes, but sometimes a more kind of multidisciplinary approach for weight loss can be beneficial. Um, but certainly we can go over, basic tips in clinic.
Mhm.
With a dietitian, like watching what the calories that you're drinking, trying to eat more fruits and vegetables, trying to drink more water and less sugary drinks.
Mhm.
Um, I've found that trying to use like apps or programs or websites are tricky because the calorie needs are so different for your kiddo with muscular dystrophy compared to those standards that they use. For example, like I'm thinking of Weight Watchers, which can be
Sure.
like a nice program. It's just not tailored for your child, and so that I've
Mhm.
had people try to do that, but it's a little bit tricky. So there's a variety of approaches you could use, and I do working with dietitians super helpful, and then implementing things as a family and trying not to single out your kiddo
Yeah.
with weight loss strategies. So
Yeah.
um,
Is there, and I need to look into this too, maybe our resource center knows this, but is there an organization of neuromuscular dietitians like there is with other practices,
there
such as physical
we
therapy?
may be more of a loosely like I communicate a lot nationally with other neuromuscular dietitians. So
Okay.
if an issue comes up and we have a question, it's often that we'll be, asking each other questions and helping each other out. I know certainly with SMA, we have 3 of us on our council, but constantly have dietitians reaching out to us, so
Mhm.
it may be a little bit more informal, but even when we are able to have MDA conferences, we usually try to get together at the conference and connect. So it's a bit informal, but yes, we
Okay.
do.
I do not see anything else that has come up. So thank you, Laura, for
Okay,
your
thank
presentation today.
you.
We appreciate you being here.